In 2008, America's debts and unfunded promises for things like Social Security and Medicare rose to $63.8 trillion. Yes, that is trillion with a T, trillion. That figure doesn't count the $787 billion stimulus program, nor does it include the $180 billion bailout for AIG or the $85 billion in aid for General Motors, Chrysler, and a few of their suppliers. Add that in, which is really chump change when you're looking at trillions, and take our current population of 306 million, you get a debt obligation of $211,934 for every man, woman, and child in the United States. Has the government gone too far? Is the U.S. drowning in debt? Dan Mitchell is with us, senior fellow at the Cato Institute. Christian Weller is senior fellow at the Center for American Progress and associate professor for public policy at the University of Massachusetts, Boston. Good to have both of you with us. Dan, what it seems like has happened in some way, and maybe without anybody consciously wishing it to, is that once you started, you couldn't say no to anybody. And so we're in this position where to protect jobs here and there in banking and in autos, and to protect housing prices from going down any further, and the list could go on and on and on, we're just going to keep printing or borrowing money. Is there any way to stop it?
Well, unfortunately, politicians only think 2 years down the road or whenever their next election is going to happen. So in all likelihood, the debt situation we're in now is going to be worse. And I don't say this as someone who is anti-debt. We went into debt to win World War II. That was a good thing to do. Families go into debt to buy houses. Normally, that's a good thing to do. There's nothing wrong with debt if you're using the money for something valuable. But when Bush and Obama put us in debt to finance bailouts and big government programs and unfunded entitlements, that's the problem. What we're getting for the money is a bigger, more wasteful government. We're becoming like France or Argentina. That's the mistake.
Christian, can I ask you about that point there, whether Argentina specifically or generically? One of the real concerns seems to be that the government is trying to reduce the pain. Well, right? By holding prices up, and we're borrowing money to do it. And has it ever in history worked where prices haven't eventually fallen anyway, leaving you with the giant debt burden?
Well, the debt burden is certainly an issue. Argentina, in fact, went into debt because it pursued some of the policies that Dan usually advocates. But that's an issue for another debate. The main issue here is that the Obama administration is certainly keeping the eye on the ball, and that is long-term growth. A lot of the money is being spent, for instance, to improve our education system, to make our healthcare system more efficient, to improve our infrastructure. And that costs money, and money that we don't have, but that we need to spend at this point to invest in more long-term growth. I think the most important thing, the fastest way of getting out of... The lion's share of the money so far
actually isn't for any of that. I mean, infrastructure got an incredibly small part, actually, of the stimulus.
It was a substantial amount in the initial part. The other part is you do need to separate two issues out. We have one of the worst recessions in decades. At the same time, we also coming off 8 years of very, very low growth. And we have a problem on the investment productivity side. So you have a short-term problem, that is the recession and financial crisis, and you have a long-term problem, that is the lack of investment and capital formation. And we have had failed policies that got us into the situation. So you're trying to rectify a number of things here in the middle of a major crisis, and that ultimately drives the economy, at least for the short run, a little deeper into debt. But I think that's an unavoidable necessity, and certainly an undesirable necessity, but nevertheless a necessity in order to get the economy back on track. And ultimately that means faster growth that will allow us to reduce the debt burden relative to GDP.
And Dan, that is something that the president has said he's going to do, right? He's going to slash our debt relative to GDP over the next 5 and 10 years. I'm sure that's his goal, but when has a forecast over 5 or 10 years for government, our government, ever been accurate?
Well, but politicians are like a bunch of alcoholics who promise that they're going to get on the wagon 2 months from now. But for right now, they still have to go out binge drinking. What really gets me about listening to Christian, and I love Christian, he's a great guy, but the Bush and Obama policies are exactly identical. Big government, more intervention, all these programs that Obama is wasting money on, education, infrastructure, these are exactly the same programs that Bush increased dramatically. The lesson that we have to learn, what all the evidence shows us, is that government, especially the federal government, doesn't work very well. And if we want faster growth, we need to be more like Hong Kong, not more like France. And Christian wants us to be France.
Let me jump in, because Dan really, I think the unfair point is the comparison between Bush and Obama. I think if you look at one of the biggest issues here is healthcare reform. And Bush certainly was spending like a drunken sailor on healthcare side, especially on a Medicare prescription drug benefit.
Which was the biggest entitlement in this country since Lyndon Johnson.
I think that's one area where Dan and I agree that was wasteful spending in many ways. But that's exactly
the
area where Obama is focusing on reducing healthcare spending in terms of finding the savings, making the healthcare system more efficient.
His spending is going up too, though.
If you look at the latest projections, that is about 1/4 of the projected deficits comes from healthcare savings, and certainly that's ultimately the big part.
Although in the near term he wants to increase taxes on the people at the top to pay for an increased healthcare spend. That's a fact.
Look, when we talk about bringing the debt down, bringing the whole returning to fiscal responsibility, you can only do so much on the spending side. When we talk about spending, we're talking about healthcare, we're talking about defense budgets. At the other side, you do need to generate more revenues in order to bring the whole fiscal house in order over the long term.
It's a fair point, but in any household, sometimes when you spend more than you earn, you just have to cut. And the bank cuts you off at some point, which I guess is when we're saying, where is that point?
Exactly
Maybe we're not there yet.
If you look at the numbers from the OMB, from the White House, where they are talking about reducing is the savings on the healthcare side. It's also the savings on the defense side. And I think then you have got all the savings that you can
You're arguing that giving government more control over healthcare is going to bring costs down. Every time government gets involved, costs go up.
This conversation is a TBC. That would be to be
more efficient
continued.
than the private sector side.
Gentlemen, we'll have you both back. I know this is the tip of the iceberg, and it's one, believe me, we will be tackling again and again. Good to have both of you with us, as always.